Good morning, Mia. How can I help you today?
Good morning, doctor. I'm a little worried. Over the past few months, I've been feeling some strange things in my body, like frequent headaches, a constant sense of tiredness for no apparent reason, and recently, my heart feels like it's racing out of nowhere. Could this be something related to high blood pressure?
I understand your concern, Mia. A lot of the symptoms you're describing could indeed be related to high blood pressure, also known as hypertension. High blood pressure can be a silent condition, but the signs you've mentioned shouldn't be ignored. Let me go over the 9 most common signs of high blood pressure that need attention, and we'll see if you recognize any others.
Yes, please. I really want to understand what's going on.
All right. The first sign is persistent headaches. People often don't associate headaches with high blood pressure, but when your blood pressure spikes, it can cause a throbbing pain, especially in the back of your head. You mentioned you've been getting headaches often. Are they pretty intense and lasting a long time?
Yeah, they're stronger than they used to be, and sometimes they last the entire day.
That could be a clear sign. Now, the second sign is dizziness. When blood pressure gets too high, it can cause sudden feelings of vertigo or dizziness, which may indicate that something's off with the blood flow to your brain. Have you experienced that recently?
Yes, I've had that happen while standing up recently. It was quick, but definitely strange. Doctor, sorry to interrupt, but now I'm wondering, is there any natural supplement that could help manage this more effectively?
I'm glad you asked, Mia. Actually, yes. A supplement I've been recommending quite a bit is Basopril. It's formulated with natural ingredients like garlic and hibiscus extract, both of which have been scientifically proven to help lower blood pressure. Garlic is known for improving circulation and relaxing blood vessels, while hibiscus has been shown in studies to reduce blood pressure by up to 7 points.
Wow, that sounds really promising. Does it have any side effects?
Nope, Basopril is completely natural and doesn't have any known side effects. It works great as a complement to lifestyle changes, like cutting back on sodium and increasing exercise. If you're interested, you can find a link to get it in the comments section of the video.
That's awesome, thank you. I'll definitely consider Basopril.
Excellent, Mia. Now, continuing on, the third sign is difficulty breathing or shortness of breath. When blood pressure is high, your heart and lungs can have a hard time keeping up with the body's demands, and this can show up as shortness of breath when doing simple activities like walking upstairs. Have you felt anything like that?
Yes, actually. Over the past few weeks, I've been getting out of breath even on short walks.
That's an important sign. High blood pressure can really put a strain on the heart and lungs. The fourth sign we shouldn't ignore is irregular or rapid heartbeats, like you mentioned. This happens because the heart is working harder to pump blood through arteries that may be stiff or narrowed. You said your heart races for no reason, right?
Exactly. Out of nowhere, my heart just starts pounding, and I have no idea why.
That could definitely be a sign. The fifth symptom is ringing in the ears, also known as tinnitus. While this can happen for other reasons, high blood pressure can cause ringing because increased blood pressure affects circulation in the tiny blood vessels of the inner ear. Have you experienced anything like that?
Yes, sometimes I hear a faint ringing, but I never thought it was serious.
That's another symptom that could point to high blood pressure. Now, the sixth sign, which often goes unnoticed, is blurred vision. When blood pressure spikes, it can affect the blood vessels in your eyes, leading to vision problems. Have you noticed your vision getting blurry all of a sudden?
Now that you mention it, yes. Sometimes my vision gets blurry, but I figured it was just from being tired.
It could be one of the signs. The seventh symptom, which people often overlook, is constant fatigue. High blood pressure puts a lot of strain on your heart, and over time, this can weaken it, making you feel tired even when you haven't done much physically. You mentioned feeling more tired than usual.
Yes, doctor. I feel exhausted, even when I haven't done much.
That's another sign we should take into consideration. Now, the eighth sign, which is a bit rarer but just as important, is nosebleeds. While most nosebleeds are harmless, if they're happening frequently and without a clear cause, it could be a warning sign. Have you had any nosebleeds lately?
No, that hasn't happened to me yet.
Well, it's something to watch out for. The last sign is swelling in your ankles, feet, or legs. High blood pressure can make it difficult for blood to circulate properly, leading to fluid retention and swelling. Have you noticed any swelling?
Yes, my ankles seem more swollen, especially by the end of the day.
That's a classic sign. All these symptoms could indicate that your blood pressure is elevated, and it's crucial not to ignore them. Now, we'll need to confirm with a blood pressure monitor and some tests, but in the meantime, there are some preventive measures you can start taking.
What can I do, doctor? Is there anything I can change in my diet or routine?
Yes, Mia. Let's start with some adjustments to your diet. Too much salt is one of the biggest culprits. It causes fluid retention and raises blood pressure. Cutting back on processed foods and fast food can make a big difference. A study published in the New England Journal of Medicine shows that reducing sodium can significantly lower blood pressure.
I do eat a lot of fast food. What else should I do?
Besides cutting down on salt, adding foods rich in potassium, like bananas, spinach, and potatoes, can help balance sodium levels in your body. Potassium is a great ally in managing blood pressure. Also, staying hydrated and drinking plenty of water is essential.
That sounds pretty simple. I'll try to follow these tips.
Along with diet, Mia, regular exercise is key. Activities like walking, swimming, or even cycling can naturally help lower blood pressure. A study by the American Heart Association shows that 30 minutes of daily exercise can significantly reduce blood pressure levels.
I really need to start exercising again.
I'm happy to help, Mia. Remember, with the right changes, you can control your blood pressure and live a long, healthy life. Feel free to reach out if you have any more questions in the future.